All right, so I just wanted to start off with giving a little overview about the Arizona Health Disparities Center and some of our current activities, as well as the National Plan for Action and how what we're doing currently in Arizona or my office to align with the national strategies and objectives that have been developed on the national level, along with regional committees and local partnerships. So the Arizona Health Disparities Center, its mission is basically to promote and protect the health of all populations in Arizona. And our vision is really simple, that we envision the state that every population in our state has the opportunity to reach their full health potential, in other words, their health equity. So the Arizona Health Disparities Center was originally established in 1993 as a liaison position with an office at that point, which was called the Local Health Office. And due to various reasons, the funding for it, the support kind of diminished over the years. So I really don't know too much about the history between 1993 and 2004, other than when it got reestablished in 2004 in the current office it's in right now, which is the Bureau of Health Systems Development. And it was funded through, and it's still currently funded through the Office of Minority Health, through the Department of Health and Human Services. And in 2006, the office was originally named the Office of Minority Health. And at that point, there was some realignment and some new vision and direction within the agency. And so we changed our name to the Arizona Health Disparities Center. And since then, a lot of the offices across the United States have changed their name from either Office of Minority Health to Multicultural Health or Health Equity. I'm pretty sure we're the only one that has health disparities in our name. And I think I like the name probably because I'm the office chief, but but I think some people, do bring to my attention that health disparities is often has a lot of negative to it, and that's true. We do know what all the bad stuff that's out there in our community, but we really are trying to focus all of our activities to show the other side of health disparities, the positive that's in our communities, that there are our underserved communities have a lot of things to bring to the table. Sometimes our culture gets pegged as something negative, as a risk factor, but really there's so much richness in our culture that it really, creates the resiliency in our communities and creates who we are and can move us forward in a positive direction. So the office is also the federal designee for the state, so it's the State Office of Minority Health. And we're also members of the National Association of State Offices of Minority Health, which is a subsection of AHDC, which is the Association of State and Territorial Health Officers. And so it's a national organization that basically brings all the state health departments together as an association. There is NACHO for the local health officers, for the county health departments to come together, and so we're part of that AHDC, that larger level. So just a few things about what we do at the center. So we have we try to really be the central resources, the central point for information. We do a lot of data gathering, and we also have that on our website. We do have weekly updates. I know that a few of you from here are on our are on our mailing list and get weekly updates from us. Anything from that data, funding opportunities, conferences, anything that's out there that's relevant into building the capacity of Arizona community members to address health disparities. We also have a quarterly newsletter, and part of that newsletter, we do have a section that features the latest research that's going on in addressing health disparities center, and SIRC has graciously agreed to provide us with those latest research updates for our newsletter articles. So if you guys don't get our quarterly newsletter, please let me know and we can sign you up so you can get it out. And actually, that's what I forgot to bring. I meant to bring copies of our latest newsletter, which was released on October 31st, and there was some great information in there. So, but we we publish it electronically. We don't really publish it hard copy, but we can make copies when available. Yeah. The other things that we do are similar to what SIRC does here. We do host the brown bag sessions for, they mainly started to increase awareness about different health practices, beliefs within ADHS. And that's where it started, but since then, because we are an organization that has so many partners, contractors in the community, a lot of what ended up starting to happening that our community partners our partners within the agency started to invite their community partners. And so really now, while we do still focus on the agency employees, it's not limited to ADHS employees, because we try to basically present topics that are reflective of what's going on in our current environment, and that the tools that we present at these brown bag sessions could be applicable in different settings. We're currently have not had a brown bag in about 2 months, because we've been working on a new series that we're going to start in January. We're going to focus on the entire year on social determinants of health, and so it's second Tuesday, except for January was a little bit off because of the holidays. We're going to start the third Tuesday of January, really focusing on what are social determinants of health, what can be done, what it's being done, and what tools are out there to address these in our communities. But we're going to start off with the first session on talking about race. That's the basic introduction. Is just talk about what is race, how does that impact our health, and we'll be using the unnatural causes as well as a part of our discussions. We won't be showing the entire clip during our sessions. We'll probably be just using a 5-minute clip from unnatural causes and building our discussion and really building some interactive activities, small group activities. For the first session, we're going to have Dr. Whitaker lead the discussion on race. And so we'll make sure to get that information to SIRC so that it could go out to the community, so that you guys are more than welcome to join us at the department. It'll be at the Igloo, which is a state lab, where we'll have plenty of room for outside guests to come and join us. So we do do a lot of leadership building through networks, community capacity, technical assistance. We definitely, while we work with the community works with us as well. Without the community, we wouldn't be able to do our work, and we really depend strongly on each other in order to address health disparities. And the center really, within ADHS, serves as a vehicle to bring and highlight minority health issues and cultural competency and language access issues to the table. So we've been doing a lot of trainings within the agency to bring our own staff members to the level that we need them, and to ensure that the community is being served in an appropriate, culturally and linguistically appropriate manner. So I think that's, yeah. So that brings me to one of the task items that we're working internally with ADHS. We do have a language access task force within ADHS. We're looking at developing a policy and procedure to appropriately address and improve how we provide language access services to our direct clients within ADHS. We don't have a lot of portals that really gives us direct access to the community members, but there are some, like our Vital Records, our state hospital, and a lot of our other projects and programs are through contracts. And so, but we still want to make sure that we're building the customer service of the agency to make sure that we're addressing and meeting the needs of the population in a culturally and linguistically appropriate manner. The next bullet under language access, we actually do have a partnership with our own ADHS Refugee Health Program Coordinator and Asian Pacific Community in Action, and Doug's back there. Zenith's been a part of the community planning team. And so what we're doing right now as a group, and we also have the association, Arizona Association of Community Health Centers, as one of our community team members. We've been looking at developing a survey to assess the local public health system and our capacity in addressing and meeting the needs of language access needs of our community members. We have done some promotion because we would love to recruit more team members, but we haven't been very successful. I was like, what? People don't want an additional task to do on their list? So I'll put it back out there for anyone who might be interested. You know, we'll definitely like to have more team members on our committee. So you know, right now we're going to focus on the community health centers across the state. We've been talking to a lot of the, a couple of the CEOs from the community health centers, as well as some of their medical directors, and providing some strategies in how to best disseminate the information. A couple of them have actually reviewed the survey and provided us some feedback. The survey, I have to say, was developed with a lot of partnership in Nebraska. Our counterparts there have done a lot of extensive work on language access issues, and so they provided us with a tool that they use to assess the language access capacity in Nebraska. And so we, they're at Nebraska. Yeah. Okay. Yes. They have actually are in their second phase, actually, of their language access. Yeah. So they first started off, I think, looking at just some particular hospitals, and now they're looking at some other organizations that are expanding it. So they provided us a starting point, and we've used that as a template to adapt and tailor it to our needs. We also received some assistance from the National Association of Community Health Centers. They also did a survey around language access as well, not too long ago, about 3 years ago. And they also provided us with their assistance, and they've also reviewed it, the survey. And so we were a little bit conflicted with whether or not we were bombarding the community too much, because they get a lot of surveys, and especially around language access. But we did find out that it was a randomized sample, so not everyone in Arizona had the opportunity to participate in that process, and so they felt that it would be okay for us to come in and ask some more questions about what's going on in the community health centers. So we're hoping that this will all lead to maybe a Know Your Rights campaign, or a educational process for our community members who have limited English proficiency. And so that's something we've been working on. We're really excited about that. The other project that we have right now is our REACH grant. And I know that some of you guys have heard about it because I've talked about it a little bit in our CAB meetings here. But basically, it's a CDC-funded grant. It's funded in phases. We're in year 2 of the first 2 years, and then we're in the springtime we'll be competing for years 3, 4, and 5, and then followed again for a competition for years 7 and 8. And it's basically to identify and address policy, systems, and environmental changes, but using a community-driven approach, which is not a very far-off concept of what SIRC, is about. And so it's really ensuring that the community is a part of the process, developing the vision and mission of the project, and getting their buy-in in developing a community project that would be beneficial to the community. And Doug, who's in the back, he's actually one of our advisory board members for the project as well. Am I missing anybody else? No, I think he's the only one in the room right now. And so he's been a wonderful asset to our project, and we're moving into a second phase of the REACH grant. We're going to be doing some more focus groups by race, ethnicity throughout the Maricopa County. That's another thing. It's very specific to Maricopa County. There are other grants similar to this. That's for the reason why we're partnering very closely with Maricopa County Department of Public Health. They have a grant right now as well that focuses on quality improvement. And the reason why we fit in so well is because one of their assessments that they had to undergo is a local public health systems assessment. And part of the REACH grant, we are doing what it's called MAP assessment, and there's 4 phases, and within one of those phases is the local public health system assessment. And so we've definitely been working very closely with each other so that we're not duplicating any of our efforts. And then the state, the ADHS, received an equivalent of this quality improvement grant that Maricopa County has. So now that the state has one, the program manager there is working closely with us and making sure that whatever requirements she needed for her grant, that she's having that met through what Maricopa and Arizona Health Disparities Centers is doing together. So there's, again, trying to reduce the duplication there. There's other actually communities that have received that similar grant of the quality improvement, which is Navajo Nation, the Gila River, and I think there was one, I guess Maricopa, and then the state. So there was 4 of them total, so that's about right. Yeah. All right. So then there's the Arizona Health Equity Plan, which is a process that we've been working on for about 2 years, I think. Doug's been a part of the process too, so he can help me out here. So we initially started off with a small grant, about $36,000, to go out to the community and basically ask the community what is health disparities to them. But we asked them in other words, and we didn't really use health disparities as the question. Although we did ask, because we did 2 phases. We did one with health providers and we did one with health consumers. And for the health providers, we did ask them, what is health disparities? What is being done? What are those challenges to overcoming the health disparities? What are some of the solutions to overcoming those barriers? And we basically asked the same questions for the health consumers as well, but in more layman's terms so that they can understand what we were talking about. And there were, out of the focus groups across both sections from both the health consumers and the health providers, and when I say health providers, I mean physicians or clinicians, but also public health, social workers, human services. So we kind of lumped all those health-related professionals together into this health providers category. And across the board, from both groups, there were 6 health concerns that were identified as being, in no particular order and ranking them, but that diabetes, obesity, cancer, substance abuse, heart disease, and teen pregnancy were the main concerns for both of those 2 groups. And so what we ended up doing in March, we brought together a group of stakeholders from across the state, about 50 people, and we asked them to help us prioritize some of those issues, because while we like to address all of them, we unfortunately cannot do all of it. I know. And so the group decided that the Arizona Health Disparities Center should make obesity, diabetes, and heart disease the top priorities for the Arizona Health Disparities Center. And from that, we've been working on, through the summer, we developed, had a strategic planning team that helped us bring together and develop some strategies as well as some goals to create our health equity strategic plan for the center. And we're still working on finalizing that right now, and so I hope to get that out before the end of the year. And because we still want to get feedback from the community to ensure that we are on the right path, but also to say that with the next bullet points, the National Plan for Action, and which is the summary here. And so you'll see in the back of it that there are 5 goals with 20 strategies that were identified as important. And the reason I brought this up next is because in the development of our health equity plan, basically some of the key strategies and initiatives or things that we had to address were the same, basically the same ones that are listed here, these 5 goals. They aligned, and they might not have been the exact same words, but basically those overarching themes came out from both the health consumers and the healthcare providers as being issues that we need to address in order to address health disparities. And so this plan was actually released in April 8th. Did I put the, no, I didn't put the date on. I believe it's, if I remember correctly, it was April 8th, 2011. And the Arizona Health Disparities Center did have the honor of being invited and hosting a regional launch event for this national plan. We had about, literally, I think 2 weeks to put it together. And it turned out, other than we had some technical difficulties, lots actually, now that I think about it, we, the National Office, or the Office of Minority Health at Department of Health and Human Services held their national launch in DC, and they were broadcasting it, and so they archived it because, of course, I think they had it at 7 a.m. Arizona time. And so they recorded it, and they were going to make it available to all the regions so that they could show it at their regional launching parties. And of course, when it came time to show it, it was not available on the online to the link they had provided us. And then on site, we had some technical issues with broadcasting our own launch to the rest of the regions. So we had, you know, we did what we could. And so, but the national plan, I guess the other bullet point there, if I don't want to skip it, is that we actually just have been came back from a world tour of Arizona in October. We went and had region or local events to promote the plan throughout Arizona. But I guess what I wanted to say, I think that's on my next slide. No, not yet. Okay, well, I'll get there. But basically, this national plan has been a process of over, I think, 5 years. The Office of Minority Health started off with they hold on every other year. There really hasn't been any consistent of when they hold these national conferences on health disparities, but I believe they had a health disparities conference in 2005, 6, somewhere around there. And basically, it was a national conference, so they brought stakeholders from across the United States, and that's where they started the conversation about pulling this plan together. And from there, they developed a process in order to go out to the region. So there's 10 regions in the United States, and they held these regional conversations where they asked the state offices, and when I was not part of that process because I was still not part of the office chief at that point, to nominate community members from academia, from community-based organizations, faith-based organizations, from all these different organizations to be a part of these regional conversations. And that regional conversation for Region 9 and 10 was actually hosted in Scottsdale in April of 2008. And so that's when they really brought together and heard people's comments about what they wanted to see, not only in the regional plan, but also in the national plan. And so there was also a consensus meeting that was held in August of 2009, and there was all these different phases to the plan. So they really wanted to ensure that they were having the community involved in developing this national plan. So you can see from the mission, I think that's why it also says that it's to increase the effectiveness of all of our programs that are addressing health disparities, but through the coordination of partners and stakeholders and leaders that are committed to health disparities. And so the goals, as you guys have on the back of the sheet, are listed there, is to bring awareness about health disparities, to ensure that the leaders have the capacity to address health disparities, that we're improving the health outcomes of our populations through systemic approaches so more of addressing those social determinants of health that are occurring, and to ensure that culturally and linguistically competent and diverse staff are available to be reflective of the community. And so that's through the training and through different workforce development programs and initiatives. And the last one, which is very dear to us as well, is the data and research evaluation, that it's a community process that's brought buy-in by community and it's disseminated to be reflective and understood by the local community members. And so, this is a very important piece, and I think that we really worked hard on the Community Advisory Board for SIRC to ensure that that piece was really reflective in this last round of their P20 grant. I think I kind of talked about this. I'll just move on. Oh, well, actually, no. So what ended up happening with this national plan is that they ended up having 2 plans, because there's one that's the national stakeholder, which is all this community work that was done by the Department of Health and Human Services. But then Secretary Sibilia said that she wanted to make sure that the plan was being worked on. And so she asked all the Department of, all the Department of Health and Human Services to come up with a plan to ensure that the federal agencies were coming up and being held accountable to ensuring that the health disparities was being addressed and that the plan was being executed. And so they built their HHS action plan to ensure accountability. And there's more to this pie. So there's also these regional health equity councils that were developed, and these regional, so every region has a regional council, so that as a region they could work together on developing some strategies and initiatives to ensure that the MPA goals or the National Partnership for Action goals and strategies are being implemented and addressed. And so they wanted to make sure that the membership for the regional councils are individuals from the public, again, non-federal employees, that are really invested in addressing health disparities and bringing health equity to the forefront. So in Region 9, which includes Arizona, California, Guam, Hawaii, Nevada, and the Pacific Islands, there are 37 members, and there are 7 from Arizona. And we had our first regional meeting in September in Las Vegas. And boy, what can I tell you about this council? We all have a goal of addressing health disparities and reaching health equity, but we all have different methods and different ideas on how to get there. So that was a very interesting experience to watch everyone's personal dynamics come out. But it was a really, I have to say, it was really a good experience too, because it shows that there's a lot of individuals out in the community that are really invested and committed and been working on this issue and want to still see this as something important in the work that they do today. So here are the list of our regional health equity members. There's Robert Guerrero. He is the office chief of the Office of Border Health at the Department of Health Services. Hope McDonald Lone Tree. She is a former legislator in the Navajo Nation. And so right now she is serving as a tribal relations consultant. Dr. Elizabeth Ortiz de Valdez, who is the president and CEO of Consejo Latino de Salud, who is also a CAB member here at SIRC. There's Dr. Cecilia Rosales. She is a professor at the College of Public Health, University of Arizona, and now she's also the director of the Phoenix program, so she's just down the street from us here. And there is Chris Vijay, which I have not the pleasure to meet yet, but I'm hoping that I'll be able to meet him soon. He's out at Scottsdale Healthcare Center, and he's a cardiologist there. And I have not met Don Yellowman either. He's the president of Forgotten People up in Tuba City. And then there's me. So there was a lot of ways to be selected to be on the regional council, and one of the ways that the Department of Health and Human Services went about that, they did a public nomination call for nominations through their website and through their different listservs that they have, as well as nominations that came through the regional conversations that I mentioned earlier, so that those big lists that were developed by, at that point, whoever put those lists together from the state office, that's where they got some names from as well. And then for the state offices of minority health directors, each region allocated 2 seats for a state director to be on that particular regional council, but it was up to the state directors to nominate each other and then vote on who would be selected from the region. So I was nominated by my peers as well as the director from California, and we were both selected to be on the regional council. Oh, and this is just a little recap, the fun stuff that we did did in October. So we partnered up with Campesinos Sin Fronteras. They're in San Luis, Arizona, and we had Mr. David Rogers, who's the CEO of Sunset Health Center, provide the keynote address, and we invited also a local physician from San Luis to provide a health education seminar to their community members that are active participants already with Campesinos Sin Fronteras to learn more about diabetes, how to control for diabetes, and what you can do to improve diabetes within that community. And we had a testimony from one of the local participants there that's part of some of the movements and activities going on in San Luis. And it was just a really good event. This event was really focused on the community. It was different from each event took its own phase. We really wanted to make sure that the partners that we worked with were able to have a voice and really create the program to what best met the needs of their community. And so this one really focused on community members. And it was conducted all in Spanish. The Flagstaff event was completely different. Our partners there were North Country Community Health Center as well as Coconino Public Health Services District. And the focus of this event really was on the leadership in Flagstaff, community leadership. So we had North Country's Chief Medical Officer provide the keynotes. He provided some new data that came out through the Health Affairs Journal. They just had published a whole journal on all these health disparities research that's being conducted throughout the United States. And so, he used some of the latest research and data that's out there. We featured two projects in the community that are really working to address health disparities. We talked about one of the projects was Vida Hermosa, which is really what I felt what we're trying to do with our REACH grant. And the Department of Health also provided an overview of one of their programs. We also had special remarks from Liz Archuleta, a county supervisor. She came in and gave a personal story and then just really thanked the community for doing the work they're doing in order to address health disparities. Tucson was a little bit different. It was part of a Binational Health Month is in October, or Binational Health Week, which now I think they're doing Binational Health Month. And so we really leveraged that opportunity to bring in some information about health disparities, the national plan. So we worked with El Rio, the Office of Border Health, the U.S.-Mexico Commission on Health, and we talked about what was the importance about being physically active and nutrition, and El Rio offered a Zumba class at the end as well. So it was fun. I think some of you guys know Hong. I decided to put Hong on there. She doesn't like to take pictures, but I thought that was a great picture of her. So she doesn't know she's up there. But that was a great picture. And then our Phoenix event, we actually did it in partnership with Tanner Community Development Corporation, TCDC, Black Nurses Association, Phoenix Chapter, Tiger Mountain Foundation. And we were part of the larger campaign of the Let's Move campaign that's led by TCDC here in the Phoenix area. And so again, we were talking about the importance of nutrition, physical activity, different alternative ways to be healthy. They really focus on community gardening, so the event was around community gardening and healthy food alternatives. And we had one of our nutritionists from the Department of Health Services come out and do the presentation. But it was a really great event. Yeah. And then I just wanted to put up our websites up there where you can learn more about these wonderful federal reports and plans. And this is I brought the executive summary 4-page, but I think this report is close to 400 pages. So yes, because there are 20 strategies within each of the strategies. There are sub-objectives, and so the objectives and action steps just kind of go on and on and on. So this is a really quick at a glance of all the goals and strategies. So now that I've confused you and bombarded you with all this information, but great information, I think.